Hi, this is my client. His name is Rance. I'm going to be performing my clinical bedside evaluation on him. So this is the oral mech part of the exam to let me know if I can move on to the food trials portion. So as you can see, he has good posture sitting at 90 degrees. His cognitive state is intact as he's been responding to me and following directions and conversation. He has no anterior loss present. He's not in respiratory distress as his breathing is inaudible. He's breathing through his nose. His timing of swallow is not affecting his respiratory status as well, so that's all good. I haven't actually checked to see if he can hold his breath, so we'll do that now. So Rance, in a second, I'm going to have you hold your breath, puff your cheeks with air like this, and I'm going to count to 5. Okay, so when you're ready. 1, 2, 3, 4, 5. Okay, you can release. So he was able to hold his breath. That lets me know that he should be able to chew and swallow safely while he's holding his breath on that. So now I'm just going to look at his face and neck structures, make sure there's nothing out of the ordinary there. So everything appears symmetrical. I see no abnormalities or scarring anywhere. Nothing to be noted of concern as far as the outside. And now I'm going to look in your oral cavity. Is it okay if I put on gloves and look inside there? Okay. And I'm still just looking at structure. So we will not be assessing the function of anything inside just yet. So I'm going to use my tongue depressor, and I'll probably have to press down on your tongue and on your cheeks to the side just a little bit. Is that okay? Mm-hmm. Okay, it shouldn't be uncomfortable or anything though. Okay, so I have my pen light and my tongue depressor. Okay, open for me. Okay, I see his tongue. I'm going to press on your tongue a little. Say ah.
Ah.
Okay, I see his tongue, his uvula. Open a little wider for me. His anterior and posterior fascial pillars. Okay, a little wider. Good. I see his teeth with just some minor dental work, like fillings, nothing to be worried about. His hard and soft palate, everything looks symmetrical, nothing abnormal to note. Okay, you can close. And now I'm going to pull on your cheeks on the inside just a little to look at that little space between your teeth and your cheek, your lateral sulci, okay? So open. Good. Good. Okay, so everything on the inside as far as structure looks great. And now I am going to have you do some oral motor movements for me. So I'm going to set this down. I don't actually need it at the moment. Okay, so open your mouth for me. You can leave your tongue in. Good, you can close. Okay, I'm just checking your jaw movements now. So now I'm going to put my hand underneath his jaw and provide a little bit of a resistance when he's opening. This will help me know about jaw strength with chewing. So open. Good, close. Okay, perfect there. Now I'm going to put it on top, my hand on top of your chin as you open, and I'm going to provide a little bit, or as you close, to provide a little bit of resistance there to see if you can close your mouth. Okay, so open up, close, good. Okay, now I'm going to check your lateralization, how you're able to move your jaw from side to side like this. You do it. Good. And his jaw was definitely moving. It wasn't just lips moving there. Okay, and then pull it forward like this. Perfect. Okay, so now I'm going to check your lips. So pucker for me. And then a big smile. Good. Fill your cheeks with air. Good. Okay, and now I'm going to check that labial seal a little bit more. I'm going to put this in between your lips in between your lips. It's okay. You can keep it shut for a second. On both sides, and I'm going to pull slightly towards me, and you're going to try and keep this in between your lips, okay? So open, close, hold it. Good. Other side. Good. Okay, so no weakness there. He's able to maintain that seal, kind of like I said, no anterior secretions were noted. Okay, so now I'm going to look at your tongue and the way it moves. So stick your tongue straight out for me, side to side. Good. Down. Pretend you're licking your bottom lip. Okay, good. Straight up. Pretend you're licking your top lip. Good. Now stick it up inside like this. Good. Okay, and now I'm going to see how you can pull your tongue back. So you can make the G sound if you need to for this. So like, you can watch me. G.
G.
Good retraction there. Okay, now I want you to pretend that you have peanut butter on the roof of your mouth, and you're going to make your tongue move from the front to the back like this, trying to clean that peanut butter off. So watch me. You try. Good, strong movement there. Okay, and now I'm going to check how you can move your tongue from side to side inside your mouth to see if you could clean that lateral space in between your teeth and cheek if food were to get stuck there. So I'm going to put my hand on each side, and you're just going to push towards that cheek for me. Good. This side. Perfect. Okay, so everything looked good there as far as movements and strength on his tongue. Now I'm going to have you say some sounds for me, okay? And I'm just going to listen for the rate and the rhythm. I'm going to count to 10 seconds, and then you can stop afterwards. So the first one will be pa 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 pa, as fast as you can whenever you're ready. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Okay, good rate and rhythm there. Now we're going to do it with ta. So it'll be ta 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 as fast as you can while I count to 10. Whenever you're ready. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. And this is also letting me know he's got some good strong breath support there too. Okay, now we're going to try ka. So it'll be ka 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 ka. Good, you can stop. Okay, and last one here will be patika. Now if this one's too hard, we can try something else, but it'll sound like this. Patika, 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 patika. You try.
Patika, 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 patika.
Good, you can stop. Great job. That one's a little tricky. If a client is having difficulty with that, you can always say buttercup and repeat it over and over. Okay, so now I'm actually going to get back in your mouth, if that's okay, with my light and tongue depressor. Okay, and this time I'm going to look at your soft palate, which is just the back of the roof of your mouth, and I'm going to have you say a couple sounds, and I'm going to watch to make sure it elevates or lifts on both sides the way it's supposed to. Okay, and I might have to push on your tongue a little. Say, ah, oh, sorry. You have a strong gag reflex, don't you? Okay, so you can close. I'm going to have you say, ah, 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 3 times while I'm pushing on your tongue so I can watch for that elevation.
Ah, ah, ah.
Perfect. His soft palate elevated normally on both sides. And now... which I've probably almost elicited a gag reflex already, but I'm going to walk my tongue depressor back until I get a short little gag, okay? If I don't get a gag on your tongue, I might have to touch the fascial pillars on the side or the back, but I feel like we'll probably get it on the tongue, okay? And I'll get out quick. It'll be quick. Good job. And with that, I saw bilateral movement of his soft palate, and the pharyngeal wall moved slightly as well. Okay, so now I'm just going to check your oral sensitivity, how you feel inside your mouth. So I'm going to touch places on your tongue and inside of your cheek, and whichever side you feel it on, just raise that hand. Okay? Does that make sense? Okay. So open. Stick your tongue out just a little, like this. There you go. Good. 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 Perfect. Okay, sensation appears to be good in his mouth. Okay, we're almost finished. So now I'm going to actually just listen to your voice quality. Want to hear if there's any wetness, harshness, gurgliness, anything going on down in the vocal folds, okay? So I just want you to say ah, Good. Sounded clean, clear to me. And now I want to hear you make a cough like this. Good strong cough. And now a clear of your throat. Sound like this. Good job. Okay, so now I want to see how long you can hold that ah sound for me. So you'll take one breath and you'll just say ah for as long as you can until you run out of air, okay? So whenever you're ready. Good job. I got around 29 seconds. So we want typically a healthy adult to be around 20. So do you do physical exercise?
Mm-hmm.
Okay, so that's probably why yours is a little bit longer. Perfect. And once again, there was no wetness, gurgliness. Everything sounded great and voice quality there. Now I just want to check your ability to change your pitch. So it'll sound like this. Ah. Good job. And mine should go a little bit higher as being a female. Okay, and now the last thing, I'm going to check a dry swallow. So you'll just swallow for me while I'm palpating or touching on your larynx to see if it moves up and slightly forward. That's what we want it to do, okay? Mm-hmm. So can I touch your neck? Mm-hmm. Okay. So I'm actually using the 4-finger method, but I'm inverting it where my thumb is facing down. Okay. That finger should be right on the thyroid notch. Okay, swallow for me. Good. One more time when you're ready. Good. And I felt that larynx move up about an inch and slightly forward, which is exactly what we want it to do. So that conducts our oral mech exam. So you definitely can move on to the food trials. I didn't see anything abnormal. Do you have any questions?
Nope.
Okay, thank you.